Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera ya Auda penonton. Ingatlah Auda, rakyat yang sihat merupakan aset yang paling berharga buat sesebuah negara. Bersama saya Azri Yunus dalam Bual Bicara Kesihatan. Ya Auda, Bual Bicara Kesihatan merupakan satu program yang menumpukan pada informasi-informasi mengenai kesihatan. Ianya terdiri daripada 15 episod ya, sebanyak 30 minit setiap satu. Ya Auda, khas untuk Auda penonton, kali ini kami jemput beberapa orang pakar dan pegawai perubatan bagi membincangkan tentang masalah-masalah kesihatan yang semakin menular di negara kita. Episod kali ini bakal mengulaskan tentang penyakit yang sering kita dengar, iaitu osteoarthritis knee ataupun osteoarthritis lutut. Ya Auda, oleh itu, sejauh manakah Auda tahu tentang punca sebenar jenis osteoarthritis ini dan juga apakah gejala-gejala dan juga cara menghindari dan merawat penyakit ini? Oleh itu, Bual Bicara Kesihatan telah pun menjemput Dr. Sonali Pandey daripada Jurudong Park Medical Center, JPMC Brunei. Hello Dr. Sonali Pandey, nice to meet you.
Thank you very much. Thanks for inviting me to talk to
You're
you
welcome.
on such an important topic.
You're welcome. On behalf of RTB, we would like to say welcome to Studio 4 today. It is a great pleasure to have you here with us in Bual Bicara Kesihatan. Ya. Now let me share your profile to the audience. Sedikit sebanyak ya Auda tentang pakar undangan kita hari ini, iaitu Dr. Sonali Pandey. Beliau merupakan Ketua Jabatan dan Konsultan Orthopedic Surgeon di Jurudong Park Medical Center JPMC sejak 2006. Dan beliau mempunyai pelbagai kemahiran ya, termasuk Masters in Orthopedics dari Nagpur University, India, serta dari University of Dundee, United Kingdom. Beliau juga mempunyai kemahiran rheumatology dari Johns Hopkins USA serta additionally secara tambahan sports medicine dari University of Queensland, Australia. Right, back at you Dr. Sonali. Now, as the episode today is focusing on osteoarthritis knee, we should start by enlightening our audience at home by simply asking from your expertise, what is osteoarthritis?
Osteoarthritis, in simple words, is wear and tear and inflammation resulting from wear and tear in the joint. It's important to first note what is a normal joint. If you look at the picture on your left, you can see a normal knee joint, which is formed basically when two ends of the bone meet, and to have the movements very smooth, the ends of the joint are covered with smooth cartilaginous substance. It's called cartilage. Also in the joint we have some normal synovial fluid, which is a joint fluid which helps in the shock absorption to absorb the impact. The joint is stabilized with help of cartilage and some shock absorber meniscus, and this is the normal structure of the joint. If you look at the picture again, on your right you can see that there is part of the cartilage worn out in certain areas. When the wear and tear increases with time, the joint space reduces and there can be bone on bone rubbing at the ends of the bones, and this leads to extra bone formation at the ends, which is called as osteophytes. All this process is a slow progressive condition. With time, with age, the structures of the joint like ligaments and the shock absorbers will also have thinning. The synovial fluid will thin out. All this makes the joint weak and difficult to function. With wear and tear of the cartilage, the nerves can get exposed, which makes the joint very, very painful. This usually starts in stages, so it can be in the early stages and progresses from moderate to severe osteoarthritis.
Right. So thank you for the first question, Dr. Sonali. So you define what is osteoarthritis in this case, yeah? The next thing would be, how does it affect a patient if one has osteoarthritis in this case?
When one has osteoarthritis, typically in our clinic we see patients complaining about pain. Pain on loading. Whenever they are walking or climbing, patient will experience pain. Some will also have stiffness because of a joint becoming tight This makes it difficult for them to get up first thing in the morning or getting up from chair after prolonged sitting. Some will have in the initial stages swelling, which is a reactionary fluid formed in the joint. Also very common presentation in Brunei is inability to kneel down, making praying very difficult. So, in advanced osteoarthritis, sometimes patients end up using chair for their praying. Patients might experience pain on touch or warmth of the joint. Some of the patients will mention that the joint is making creaking sound when they are doing stairs. Also, some might experience that this can show tendency to have sensitivity with weather, like in air condition or in cold temperature countries, they will feel more pain in their joints. If you can see in the slide, typically the presentation could be elderly person coming with weak muscle, some change in the shape of the joint which happens because of the weakness of the structures and change of the bone shape with progression of the disease. Almost 1/4 of the population over 60 years of age could be suffering from osteoarthritis of the knee. Many times patients will present with multiple joint pains which affects their mobility and also their confidence about moving around in the society. There are certain risk factors which can be associated with osteoarthritis. So, suppose if your parents are having osteoarthritis of the knee or your siblings, there is a good chance that you can also suffer from osteoarthritis. If there is a problem with weight or obesity, with increasing age, also if you are having poor musculature or poor ligament structure of the joint, a previous history of repeated athletic injuries, these all can increase to the risk factor of developing osteoarthritis. It is very important to highlight about vitamin D deficiency. We see this a lot in local Bruneian population. This is also recognized as one of the risk factors for arthritis condition. There are a number of other conditions which damage the joint and it can contribute to the secondary osteoarthritis of the knee. Sometimes if you have problems like infection in the joint or fractures happening in the joint, or the more commoner situation like gout can actually increase the risk of osteoarthritis in future.
Ya, Auda, seperti yang telah diulaskan oleh Dr. Sanali tadi ya, jikalau anda terasa macam sakit di lutut, itu bermakna salah satu simptom osteoarthritis lutut ya. Mungkin kalau anda semasa anda solat, anda rukuk ataupun anda sujud, anda terdengar bunyi macam cracking noise ya di anda punya lutut, mungkin itu salah satu gejala osteoarthritis yang telah pun Dr. Sonali terangkan tadi. So doctor, you explain about how does it affect a patient, right? The next thing, from doctor's point of view, right, how do you diagnose or identify a person potentially having this type of osteoarthritis?
Many times patients' history are very clear, pointing towards osteoarthritis. Typical joint pain on walking, stiffness, these are suggestive of arthritis. Not all the times, therefore, it is very important that you consult the doctor who will have a clinical examination. Clinical examination is many times diagnostic. However, we like to document the progression of the osteoarthritis, and X-ray, especially weight bearing or standing X-rays are recommended. These can be baseline investigation for osteoarthritis. If doctor is suspecting any problems like wear and tear in the meniscus or shock absorber, one can consider MRI scan. So, if you look at the next picture on the screen, this is how a typical X-ray will look like, where on left you can see a normal looking knee joint where there is adequate space. On X-rays of osteoarthritic knee, we see decreased joint space, maybe change of alignment, and all these findings actually help doctor in planning the further care of the treatment.
Thank you Dr. Sonali. Jadi Auda, cara bagaimana kita identify atau memastikan sama ada seseorang tersebut mempunyai osteoarthritis atau tidak adalah melalui dengan X-ray ya. Kemudian doktor akan melihat dari segi X-ray tersebut sama ada tanda-tanda osteoarthritis timbul ataupun wujud di sana. Dan dari sana doktor yang pakar dalam osteoarthritis ini bakal menyediakan treatment tertentu untuk orang menghindari ataupun merawat osteoarthritis ini. So back at you, doctor. You mentioned about how we diagnose the osteoarthritis, right? If we able to diagnose the osteoarthritis knee in this case, what are the options we have in Brunei, especially to treat this type of osteoarthritis?
Whenever we are trying to treat a patient of osteoarthritis, we have certain aims at looking at what we are trying to solve. First and foremost is making patient pain-free. So relief of pain is very, very important. We also aim at restoring the function of the knee joint, making sure a patient is comfortably able to do activities of daily living and possibly the hobbies and extracurricular activities. Improving quality of life is also very, very important. While we are trying to treat, we also want to prevent further damage to the joint. So if you look at the options of treatment, it can be quite varied, right from lifestyle changes. We can talk about just patient education, exercises at home. It can range from need of physiotherapy to medical treatment, or it can involve in even the interventions like injection or even need of surgery. So it's a host of range of options we have. It's always good to follow certain kind of guideline, and this is a nice guideline from UK. It is the most popular guideline we follow for osteoarthritis treatment. So if you see, the center of the treatment is actually just lifestyle changes. So typically we will advise in obese patient weight loss. One of the common things that we see in Brunei is that most of the people are staying in 2 levels. So bedrooms are upstairs and they end up doing a lot of stairs, increasing the pressure on the knee. So a simple step of relocating to single level actually makes a big difference even in advanced arthritis to prevent and further care like intervention of any surgeries. If you are staying on one level, the pressure on the knee is very less. Then if you look at the other measures, when simple things are not working, then we might want to do higher interventions. Some of the other simple things like using walking aid is also very helpful. It can range from using either single walking stick or a walker, and this helps to take the load from the joint. It also helps to regain the balance, and I understand many people are actually shy to use the walking stick, but one must understand this is going to only help you stay independent longer and mobilize in society safely. If we look at further options, exercise is very, very important in osteoarthritic joint. We have certain aims of doing exercises. We want to make sure the joint stays mobile. It has to go through mobility because we want to overcome the stiffness. We also aim at making the muscle strong. So if you look in the picture, you can see the most important muscle doctor will always highlight is in the front of the thigh, which is called as quadriceps. Doctor might give you some exercise sheets to be done at home, or might recommend you to see a physiotherapist as well. Simple exercises like squatting, lunges can be quite helpful, but it's always important that your doctor guides as to what you can do comfortably at home. I would say cycling is a very simple exercise which can be done for osteoarthritic knee. I would say exercise bike at home, stationary bike. This will help you to get a range of movement in the joint, also overcome the stiffness. It will help you make the muscle strong, and it's also very good aerobic exercise, which is important that you keep your bones strong as well as your heart, because it's very important to have certain level of aerobic fitness also in most of these patients. There are certain other complementary treatment options available like acupuncture or massaging. I would like to highlight Tai Chi or yoga kind of exercises, which I think in Brunei we have readily these options available to the population. This Tai Chi and yoga are basically low impact exercises. They help in mobility of the joint, it helps in the stretching of the joint and strengthening of the muscles. It also helps in relieving the pain and regain the balance in the patient. So, this is a safer exercise for most of the people to adopt. When we talk about when all these measures are not helping, some patients might need simple painkillers like paracetamol or topical ointment or gel. Many people are already taking some supplements. People are aware about availability of supplements in the market, but it is very important to note that though these are the normal components of the normal joint, evidence on efficacy of these supplements is not very well established. I would rather emphasize to consider alternate medication like omega fatty acid. In right dose, if you take it, it can help you for pain relief. If we talk about the medical options further, we can talk about how we help the patients if these simple measures are not helping. We can consider injection options. We have two options of injection. First option is steroid injection. Initially this was a very popular treatment option, but nowadays we know its role is very limited. It can help in certain people, especially in the advanced stages as well. However, the role of the injection stays very limited, so it is a short duration acting treatment. Another popular treatment is viscosupplementation. This is a popular demand by many of the patients, especially those who want to consider protecting the joint in the earlier stages, also those who do not want to consider any surgical intervention. This is basically we are injecting hyaluronate in the joint, which is part of a normal joint fluid composition. This helps to lubricate the joint as well as it lines up the exposed nerve endings. This gives initially pain relief to the patients. It is very important to note that this can be a temporary treatment, it is not a permanent cure. However, it can be a good option once both doctors and patients are aware what to expect from this kind of treatment. I think that pretty much summarizes, what are the medical options and lifestyle changes that we can adopt for osteoarthritis.
Very informative, Dr. Sonali.
Thank you.
Ya, Auda, seperti yang telah Dr. Sonali huraikan tadi ya, options ataupun kata orang cadangan-cadangan ya, treatment ya, bolehlah kita consider sebagai active lifestyle dan juga suplemen. Walaupun suplemen yang telah diulaskan oleh Dr. Sonali sebentar tadi tidak kata orang di backed up by clinical study, tetapi Auda bolehlah kata orang mempertimbangkan ya untuk terapkan certain supplementsnya orang, contohnya omega 3 dan juga glucosamine tadi yang telah pun ditunjukkan dalam paparan slide. Ya, Auda, selain daripada itu, Auda juga harus, bukan harus ya, boleh mempertimbangkan juga, tetapi recommended untuk mempertimbangkan untuk terapkan lifestyle dari segi sportsnya orang yang very light ataupun ringan. Contohnya yang telah diterangkan oleh Dr. Sonali tadi, kita boleh buat Tai Chi ya, bukan saja Tai Chi tetapi juga yoga. Dan Alhamdulillah di Brunei telah pun bergiat aktif dari segi orang options available dari segi yoga dan juga Tai Chi dan sebagainya. Contohnya spinning yang very yang low impact lahnya orang. Boleh cycling tapi yang keep it low impactnya Dr. Sonali tadi. Baiklah Auda, mari kita dengarkan soalan seterusnya pula. Okay, back to you Dr. Sonali. The thing is that you mentioned about aerobics exercise as well, but it's kind of not contradicting if you consider that some aerobics exercise actually required you to move such that it utilized the knee more. So won't that just
I
make
think
it worse?
it's very important to understand that once you have established arthritis of knee, we must aim to protect it further. You have to consider aerobic activity. Aerobic as in where your cardiac or heart rate increases, because aerobic is basically keeping your heart fit as well. While we are trying to improve on our fitness, it's important that we are not impacting on the arthritic joint. So, anything which involves impact like Zumba kind of activity can actually be something that will wear out your knee faster if you have arthritis, and which is symptomatic. One must understand that not all patients are having pain even if they have arthritis. So, those who can cope and are quite happy with it, there is no problem. But if you are having pain because of arthritis, then high impact exercises are best avoided. So, exercises like cycling, swimming, they can be a better form of exercises for such joint.
Okay, thank you for the clarification, yeah, Dr. Sonali. You also mentioned, I'm interested to know about the supplements, particularly omega-3. Yeah? I also heard about omega-6 and such thing and how it's good to your body, but can you elaborate more on the dosage recommended, for example, even though it's not backed up by clinical study, especially for the omega-3 in this case?
I think there are actually better studies available on omega-3. So, whenever we are recommending, we would like to recommend something which is established and scientifically evidence based. Omega-3 supplements taken in a dose of 1200 to 2400 are known to be helpful. The effect is actually known to be as good as ibuprofen. So, it helps more in maintenance of pain relief in arthritic joint. I think it's very important for patients to consult doctors, especially to know which supplements to take, and also try to find out whether they are scientifically proven.
Perfect, Dr. Sonali. Okay, the next thing is that we do hear about patients undergoing surgeries for osteoarthritis. Can you tell us more about the surgical options in this case?
Sure. Yes, there are a number of surgeries described for osteoarthritis of the knee. They can range from simpler procedures to more advanced and technically demanding procedures. Arthroscopy is one of the earliest described procedure. It was quite popular initially in maybe few decades back, when patients regularly used to get their joints washed out. This is not known to be very effective nowadays with advances of injection treatments. However, if there is any risk of or suspected meniscal injury or tear which is catching up in the joint, your doctor might advise you arthroscopic surgery. Another surgery that is recommended is alignment of the joint, what we call as high tibial osteotomy. Whenever the shape of the joint changes, doctor might suggest you for this surgery, which is basically doing a surgery level below the knee joint and alignment of the knee joint such that the wear and tear rate is slowed down. There are certain limited recommendations on this, and this is well to be considered with recommendation only. Another surgery where only part of the joint is worn out, what we call as unicompartmental knee joint replacement, is also described, where only half of the knee is replaced. This again has to be done at hands of expert person, and this is option especially for younger population where only part of the joint has been damaged. More popular option is total joint replacement, where part of the cartilage which is worn out, it is cut, the bone is refashioned and replaced with artificial joint made of metal and polyethylene. There are certain aspects we must understand, that the artificial joints have their own lifespan. About 15 years is considered a good lifespan for artificial joint. 95% of the patients undergoing this surgery find it quite rewarding. The activities of daily living and quality of life can improve quite dramatically in such people. If you look at the X-ray picture of total joint replacement, you can see dramatic change where the affected joint is effectively replaced with artificial joint. Alignment of the knee is much straighter. Though this is not a minor surgery, if it is done in right setup at the expert hand and with proper experience, this can be a very rewarding procedure.
Okay, thank you very much, doctor. So finally, what are your advices to the audience out there who might have this type experience, the osteoarthritis symptoms that you just mentioned just now?
I think it's very important to note that osteoarthritis of the knee joint is a very common condition. Many elderly are suffering from this. This is a progressive wear and tear of the joint. Number of treatment options are available, right from lifestyle changes to medical intervention or surgical intervention, injection options. I think if you take appropriate treatment under expertise, you can improve your activities of daily living and especially quality of life significantly. So, no need to get disheartened. You can have a very healthy and active life even in senior years.
Perfect, perfect. Thank you very much for such good news, Dr. Sonali, to the audience out there. So thank you for the knowledge and information sharing about osteoarthritis, Dr. Sonali. Yeah? I believe the audience would benefit greatly from the explanations that you just given just now. And of course, we absolutely appreciate the time you spent with us here at RTB4 Studio in Bual, Bicara, Kesihatan. Ya, Auda, kita sekarang berada di akhir rancangan dan kami berharap ya Auda bermanfaat daripada episod kali ini tentang osteoarthritis bahagian lutut. Ingatlah seperti saranan Dr. Sonali tadi, Auda bolehlah kawal dari segi permakanan Auda juga di samping mendapat konsultasi daripada hospital berdekatan ataupun klinik-klinik kesihatan berdekatan Auda. Ingatlah Auda, akhir sekali, kehidupan sihat bukanlah satu diet tetapi ianya satu cara kehidupan. Wassalamualaikum warahmatullahi wabarakatuh. Salam hormat.